Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering NCLEX type questions. Now, if you haven't graduated yet, you're not about to take NCLEX, this can still be beneficial for you if you have a cumulative exam coming up, HESI, ATI. It's a mixture, guys, of your med-surg, your OB, your peds, your psych, right? Everything. So if you haven't done so already, you know what I'm going to say next. Please do not forget, guys, like and subscribe below. Go ahead and leave me a comment below on any topics you'd like to see me cover that I haven't done so yet. Also, please do not forget my audio lessons are available on my website at www.nexusnursinginstitute.com. If you need that little extra push, check out my website. All right, guys, without any further ado, let's get started. First question. A male neonate is delivered by C-section at 36 weeks gestation. A neonatal nurse is performing a newborn assessment and notes the presence of hypospadias. Which statement to the mother best describes hypospadias? 1, the penis is smaller and shorter. 2, the urethral opening is absent. 3, the urethra opens on the dorsal side of the penis. Or 4, the urethra opens on the ventral side of the penis. And guys, the correct answer is 3. The urethra opens on the dorsal side of the penis. That is your hypospadias. Let's look at the wrong answer choices. 1, penis is smaller and shorter. That's what's known as a micropenis. 2, the urethral opening is absent. That's what's known as urethral agenesis. Remember, whenever there's an A before words, that means without. That is urethral agenesis. And choice number 4, a urethra opens on the ventral side of the penis. When it opens on the ventral side of the penis, guys, that's what's known as epispadias. So epi on the ventral and then hypo on the dorsal. Next question. A client with BPH asks the nurse what can be done to manage the symptoms. The correct response by the nurse would be 1, there's really nothing that can be done except for surgical removal of the prostate. 2, increase the amount of zinc in your diet. 3, herbal therapies such as saw palmetto may improve urinary flow. Or 4, vitamin E will reduce the size of the prostate. And guys, the correct answer is number 3. Herbal therapies such as saw palmetto may improve urinary flow. Now, what happens, guys, is the saw palmetto blocks the DTH from letting that prostate enlarge. Okay, so that's how it helps. Now, let's look at the wrong answer. Oh, by the way, guys, the saw palmetto, when it comes to BPH, that's a famous question on NCLEX. They love to ask about it, so don't forget. Now, let's look at the wrong answer choices. 1, there's really nothing that can be done except for surgical removal. Well, we know that's not true because we know that the correct answer is that saw palmetto can help. So there absolutely are things that the patient can do to help decrease it. Something else, I'm getting off topic, but just so you know, what else can the patient do? Decrease fats from their diet, decrease meats, increase fiber, increase fluid intakes. And when I say fluid, I'm not talking about juice, I'm talking about water, right? So there are things that the patient can do. So that's wrong. Choice number 2, increase the zinc in your diet. Guys, zinc will delay the growth, but it does not reverse the growth. So that's wrong. What's our other choices? Oh, choice 4, vitamin E will reduce the size of the prostate. That's just a lie. No, it doesn't. That's absolutely false. So guys, that's why number 3 is the correct answer. A client who's gravid 3, para 2 is admitted to labor and delivery. A sterile vaginal examination reveals that the client's cervix is 9 to 10 centimeters dilated, 100% effaced, and at +2 station. Which action should the nurse take first? 1, administer IV pain relief. 2, prepare the client for delivery. 3, administer fluid bolus. Or 4, place the client in knee chest position. And guys, the correct answer is 2, prepare the client for delivery. Now, they gave us plenty of clues to make us realize that baby's coming soon. Look, 9 to 10. Excuse me, guys. The biggest diameter mom can be is 10, right? You don't get bigger than 10. Mom's at 9 to 10. Look at the effacement. Remember the effacement, guys? That's how thin that cervix becomes, because what happened, that cervix just kind of folds over itself and it becomes thin. You can't get more than 100%, guys. You cannot get more than 100%. Mom is at 100%. So guess what? That baby's coming. And if you look further, look at the station. +2. That baby is past the birth canal. So you better prepare the mom for delivery, because that's what is about to happen. Let's look at our wrong answer choices. 1, pain relief. That is not a priority. That baby's coming, and that's going to be our priority, the delivery. Choice 3, administer fluid bolus. For what? There's nothing in the scenario that indicate that something's wrong, that we need to give mom a bolus of fluid. So no. And choice 4, place the client in knee chest position. Guys, and this is another famous test question, so make sure you know this. When would we put mom in knee chest position? Cord prolapse. And that's not what's happening here. So there's no need to put mom in knee chest position, okay? So the correct answer for this question is going to be to prepare mom for delivery, because that's what's about to happen. An 18-year-old client's having her first gynecological examination. She asked the nurse about a pill for birth control. Which nursing statement about oral contraceptive agents is correct? 1, oral contraceptives are the best choice with just a few minor side effects. 2, most women stop taking oral contraceptives because they cause severe nausea. 3, oral contraceptives inhibit ovulation and change the consistency of cervical mucus. Or 4, these drugs can be made more effective by monitoring basal body temperature. And guys, the correct answer is 3, oral contraceptives inhibit ovulation and change the consistency of cervical mucus. And that's exactly what it does. But not only by inhibiting ovulation, what it does to the cervical mucus is make it a lot more thick and tenacious so that sperm can't get through, okay? So that's the correct answer. Now let's look at the wrong answer choices. 1, oral contraceptives are the best. Excuse me. Do we ever give our opinions in nursing? Because when you say something is the best, that's an opinion, right? Do we do that in nursing? Never. Never. You give your patients factual information and they make their decisions, but you never give your opinion in nursing. So we're going to get rid of that. Choice number 2, most women stop taking oral contraceptives because they cause severe nausea. What did I tell you about that word severe? And do oral contraceptives cause severe nausea? No. It may cause a little bit of nausea when the patient just starts taking the oral contraceptives, but that goes away once the patient's hormones start to regulate, okay? So the nausea is never that severe that the patient will discontinue, so that's false. And lastly, these drugs can be made more effective by monitoring basal body temperature. No, we don't need to be looking at the basal body temperature, because what these oral contraceptives do is actually stop ovulation from happening in the first place. So your correct answer is number 3. Which situation could lead to metabolic acidosis in a client? 1, frequent vomiting. 2, nasogastric suctioning. 3, hyperventilation. Or 4, aspirin overdose. And guys, I hope you all got this correct. The correct answer is 4, aspirin overdose. Aspirin overdose is the only one here on this list that can cause metabolic acidosis. Now let's look at our other choices. Frequent vomiting, NG suctioning, hyperventilation, all of those can cause alkalosis because the patient's getting rid of the acid. When you get rid of the acid, that puts you more in an alkalinic, a basic state. So 1, 2, and 3 will all place the patient in an alkalinic / basic state, but aspirin overdose, that will place the patient in an acidic state. A Caucasian male neonate is delivered at 33 weeks gestation due to premature preterm rupture of membranes and a maternal fever. A nurse is performing an initial assessment of the neonate. The nurse should expect to find the presence of 1, scrotal rugae, 2, Mongolian spots, 3, desquamation, or 4, vernix caseosa. And guys, the correct answer is 4. Vernix caseosa. That's that greasy light covering that you see the premature infants are coated in. That's what you expect to see. Why? Look at how old that infant is, 33 weeks 33 weeks gestation, so that's a premature infant. Now let's look at our wrong answer choices. By the way, guys, that vernix caseosa, you do see it does become apparent at 33 weeks. Let's look at our other choices. 1, scrotal rugae. We don't start to see this until about 37 weeks gestation. This fetus is only 33 weeks, so it's too early to see that. Choice 2, Mongolian spots. Who do we see Mongolian spots in? Melanated patients, right? Black patients or patients that are highly melanated. So in the question, they told us that this patient's Caucasian. So what are the chances that we're going to see that in the Caucasian patient? Not much. 3, desquamation. That's the peeling off on the skin, and that's false. So our correct answer is number 4. A client has a pressure ulcer that extends into the dermis and subcutaneous tissue. Which stage of pressure ulcer formation should a nurse document? 1, 2, 3, or 4. Guys, if you've been following me for any amount of time, if you watch any of my videos where I was covering burns or the integumentary system or wounds, I've told you a million times that this has appeared on NCLEX very often. Not only NCLEX, it's appeared on ATI, HESI. You need to know your stages. You absolutely must know them. And the correct answer, guys, is 3. Remember, when that skin, it may have some redness, non-blanchable, but the skin's still intact, you're at stage 1. But when that skin's no longer intact, but you haven't gotten to the subcu layer yet, you're in stage 2. When you get down to the subcu layer, you're at stage 3. And then when you get down to the muscles, you're at stage 4. So this question's asking about subcutaneous layer, and that's why the correct answer is 3. A school nurse is creating a plan to educate teenagers against the use of smokeless tobacco. What informational strategy would be best suited for the target population? 1, invite adults who are former users of smokeless tobacco to give presentations regarding how to quit. 2, create brochures that report the latest statistics regarding the link with cancer and dental complications. 3, run a series of anti-smokeless tobacco advertisements in the school newspaper. Or 4, display informational posters that carry images of former users' faces disfigured by oral cancer. And guys, the correct answer is 4. Let me explain why. Remember how the work of the child is play? Well, the work of the adolescent is self-identification. They start to find out who they are. And the way that they find out who they are is through their social groups, right? So remember, the adolescents, the teenagers, you know, their friends are very important to them. The way that they look is very important to them. The way that their friends perceive them is very important to them. Nobody wants to look different. As much as they want to be independent, they don't want to look different than their friends. So when you show them the pictures of their facial disfigurement and what these people will look like, and they see what they can possibly look like, and they don't want to be the oddball, they don't want people making fun of them, that is going to have more of an impact than having an adult come to talk about it, giving them a brochure or showing them statistics, right? Because they care so much about what they look like and what their friends think about them. So that's going to have the greatest impact. And that's why that's the correct answer. A nurse should determine a client with type 2 diabetes needs additional teaching if which statement is made. 1, when I'm sick, my blood sugar needs to be checked more often. 2, as a diabetic, going barefoot is unwise. 3, the goal for my hemoglobin A1C is less than 8. Or 4, losing weight will likely affect my insulin needs. And guys, the correct answer is 3, the goal for my hemoglobin A1C is less than 8. If you're diabetic, the goal for your hemoglobin A1C should be less than what? 7, not 8. It should be less than 7. If you're diabetic, you want it less than 7. And if you're not diabetic, you want it less than 5.7. Okay, so that's very important. That's the wrong answer, because if you go back to the question, it says which needs additional teaching. Whenever a question says, what needs additional teaching? What would you clarify? What would you question? What they're really asking you is which one is the wrong answer choice. And for this, number 3 is the wrong answer choice because everything else is correct. Yes, when you're sick, you need to check your blood sugar more often because when you're sick, your blood sugar, tends to go higher. Choice number 2, as a diabetic, going barefoot is unwise. That's true. Diabetics should never go barefoot, right? They should wear shoes that fit well. They should wear cotton socks. They should never wear thongs or sandals where they have that, separation between the toes that can cause excoriation, right? And choice number 4, losing weight will likely affect my insulin needs. Absolutely. Losing weight will most likely make you need less insulin than you did before. So the only one that's wrong out of this is choice number 3. A home health nurse visits a client 10 days after delivery. The client is breastfeeding her infant. The nurse's assessment includes pain, redness, and swelling of the client's left breast. The nurse suspects that the client has developed mastitis. The nurse's teaching plan for the client with mastitis should include 1, wearing tight-fitting bra for good support, 2, stop breastfeeding permanently, 3, avoiding breastfeeding on the affected side, or 4, taking analgesics for pain relief. And guys, the only correct answer here is 4. That's the only thing you do want the patient to do. They can take something over the counter, such as a Tylenol for pain relief because it's going to be painful. Now let's look at the wrong answer choices. 1, wearing tight-fitting bra. That tight-fitting bra, number 1, is going to increase the patient's pain. And number 2, that might clog those milk ducts. So we don't want mom to do that. 2, stop breastfeeding permanently? No. Number 1, that'll cause engorgement. Number 2, that'll increase the patient's pain. And number 3, in nursing, we are all about breastfeeding because we know the benefits of breastfeeding for both mom and the newborn infant. So that's incorrect. In choice 3, avoiding breastfeeding on the affected side, no, that's going to make the patient's conditions worse. So number 4 is the answer. We're just going to teach mom to go ahead and take analgesics for pain relief, something over the counter. A 23-year-old client has missed 2 menstrual periods and decides to visit a prenatal clinic to see if she's pregnant. Besides amenorrhea, the client tells the nurse that she's experienced breast tenderness, nausea, vomiting, urinary frequency, and fatigue. The nurse determines that the client has been experiencing symptoms of pregnancy that are classified as 1, predictive, 2, presumptive, 3, probable, or 4, positive. And guys, the correct answer is 2, presumptive. So all of these are signs and symptoms of maybe she can be pregnant, but it can be due to other illnesses and conditions as well. So that's why it's presumptive. Now let's talk about the other answer choices. 1, predictive. There's no such thing as a predictive symptom of pregnancy. That's wrong. 3, probable. What would be a probable, which means most likely this patient's pregnant? We're not 100%, but most likely that's what it is. Probable would be a positive pregnancy test when the HCG is positive. The Goodell sign, the Braxton Hicks, when mom feels the baby moving in the tummy, right? All of those are probable signs. Most likely she's pregnant, but we're not 100%. Positive. What is a positive sign of pregnancy? And there's only 2, guys. There are only 2 ways that we know 100% for sure that mom is pregnant and it's not, a tumor or anything else that's going on. 1 is visualization. We physically see the fetus in the womb by ultrasound. Or 2, when we can hear the heartbeat. And we know that it's a fetus in there and not a tumor. Okay? The best indication of dehydration in a client who's 85 years old would be changes in 1, urine output, 2, skin turgor, 3, hemoglobin levels, or 4, blood pressure. And if you've been following me for any amount of time, you all should get this correct. urine output. Remember, guys, I told you that the best way we can see a patient's hydration status is going to be by what? Daily weights. When we check that patient's weight to see if they've gained weight, if they're holding on to fluid, or if they lost weight. Well, we don't have weight on here. What else can we look at after weight? Output. Because here's what happened, guys. As a patient becomes dehydrated, those kidneys start to shut down because the kidneys want to conserve as much fluid as possible. So the patient will start urinating less. And there you go, urine output. Guys, it's not going to be skin turgor, especially in an 85-year-old patient that's full of wrinkles, right? Now, let's say you did not have weights on there. You did not have urine output on there. Your next choice, which was skin turgor, where would you check? Guys, this is an 85-year-old patient that has lots of wrinkles, so you need to check over a bony prominence, such as their chest or forehead, where it's not as wrinkled, and you could try to check the elasticity, okay? What should a nurse watch for in a client with autonomic dysreflexia following a cervical spinal cord injury? 1, severe hypertension. 2, sudden hypotension. 3, tachycardia. Or 4, Cheyne-Stokes breathing. And the correct answer, guys, is 1, severe hypertension. Whenever you see a question with a patient that had a spinal cord injury, you better be concerned if in that same situation, you see that blood pressure going up, the patient sweating, patient has severe headache, patient has distended bladder. You better be thinking of autonomic dysreflexia. Remember triggers, guys. Triggers for autonomic dysreflexia is that severe, high blood pressure that can cause the patient to even go into a stroke or have seizures. A full bladder, impacted feces where that patient's constipated, even the feel of a wrinkle on that bed. That's why you got to keep those sheets nice and taut, because just the feeling of that wrinkle on that bed can be a trigger for that patient to go into autonomic dysreflexia, right? So you have to be very careful. The minute you see a patient has a spinal cord injury, one of the first things that needs to be going in the back of your head is autonomic dysreflexia, because this is a medical emergency. That's why those patients with a spinal cord injury, we're going to make sure that we have an indwelling catheter, because we can't afford for that bladder to get full. We're going to make sure that that patient's getting lots of fluids, fiber. We're going to make sure that that stool doesn't get hard, because we can't afford for that patient to get impacted, guys. I don't know what's wrong with me today, right? So autonomic dysreflexia, that's that severe hypertension, and number 1 is the correct answer. A client who's gravid 1, para 0, asked the nurse about how to get back into shape after birth of her child. The nurse instructs the client about a variety of exercises, including Kegel exercises. The client asks about the purpose for Kegel exercises. What explanation should the nurse give? 1, to relieve lower back pain. 2, to strengthen the perineal muscles. 3, to tone the abdominal muscles. Or 4, to prevent urinary retention. Now, guys, this is a pretty easy question. It's no critical thinking. It's direct and to the point. What is Kegel exercises? What is the point of Kegel exercises? And the correct answer is 2, to strengthen perineal muscles, those muscles down there between the vagina and the anal area, to strengthen those muscles. Which action by the nurse would be most helpful in preparing a 2-year-old child for immunization? 1, show a video of a child receiving an immunization. 2, offer to provide a toy afterward if the child does not cry. 3, give the child a choice of 2 injection sites. Or 4, have the parents discuss the procedure the night before. And guys, the correct answer is 3, give the child a choice of 2 injection sites. So the child has to get an injection, but give them a choice. Do you want your left arm or your right arm? Or what NCLEX likes to do, the choice they give you, same situation, but you give the child a choice of which Band-Aid do they want. Do they want Superman or Spider-Man? Something like that. This is a toddler, and remember, toddlers at this stage, they're still trying to push an envelope and figure out their independence. That's why, you know, they really try to push for autonomy, but they still need the parents, right? So remember the toddler stage where they try to do things themselves. They don't want any help. The fact that you're giving that child a choice between two, the left arm or the right arm, the pink Band-Aid or the blue Band-Aid, that gives them a sense of autonomy, and that's what you want to do. Let's look at our other choices. Number one, show a video of a child getting a shot. That is going to traumatize them. You are not going to be able to get that child to stay still for the shot if you do that. Absolutely not. 2, offer them a toy if they don't cry. You don't want to do that. You want to allow the child to cry, because a child crying, that's how they are communicating their feelings. They're very upset. You want to allow them that emotional outlet. So you're not going to do that. Choice number 4, have the parents discuss the procedure the night before. So the night before, you're going to sit with a 2-year-old and discuss the procedure, let them know that a needle is going to be inserted into their arm. You think that child's going to get any sleep? No, they're going to be thinking about that darn shot the whole night. Absolutely not. At 2 years old, they do not have the mental capacity to process that the night before. No, you're going to talk to them right before they get the injection. It's going to be a very short and sweet, the explanation, and you're going to give that child 2 choices. The desired outcome following hydrocortisone injection for rheumatoid arthritis is to 1, reduce synovial fluid, 2, reduce joint pain, 3, correct joint deformity, or 4, reverse cartilage erosion. And guys, the correct answer is 2, reduce joint deformity, reduce joint pain. So think about it. Hydrocortisone, what is this? This is a steroid. What do steroids do? Decrease inflammation. Hello, rheumatoid arthritis. That's what's going on with the patient. They're having joint swelling. What is swelling? Inflammation. So when we give that steroid to decrease the inflammation, it's going to thereby decrease the patient's pain. And number 2 is the correct answer. All right, guys, we are down to our last question. The desired outcome of pseudoephedrine, Sudafed, is 1, termination of PAT, 2, reduction of intraocular pressure, 3, relief of upper airway congestion, or 4, prolongation of local anesthesia. And guys, the correct answer is 3, relief of upper airway congestion. So guys, Sudafed, what is this? This is anti-congestion. That's the wrong word, not anti-congestion. Decongestion. I can't speak today, guys. It's a decongestion. So what is it going to do? It's going to do number 3, relieve upper airway congestion, because that's what it does. It decongests. Now, one thing you guys need to remember about these over-the-counter decongestions, whenever you see a question about an over-the-counter decongestant such as Sudafed, one of the things that need to be going on in the back of your mind is blood pressure, because remember, it has these vasoconstrictive effects and it could cause the patient's blood pressure to go up. So if this patient is a hypertensive patient, they already have high blood pressure, you're going to be very concerned about that. So just keep that in the back of your mind when it comes to these over-the-counter decongestions. Guys, I hope you found this video to be helpful. If you'd like to see more mixed questions such as this, please go ahead and leave me a comment below, and I'll make sure I have more coming your way. Please do not forget, guys, on my website, I have audio lessons available where I go over specific content, chapter content. So whatever you're covering now, if you're having a hard time about it, I have an audio lesson where I explain what's going on. I explain to you what's important, what you're most likely going to see on your exam. So you better go back over this 3 times because you're most likely to see it. Don't forget to check that out. I upload new lessons every week. So if you don't see what you need now, keep checking. You might find it in a couple days. Don't forget, guys, I'm also on TikTok, Instagram. One more thing I wanted to cover with you. Oh, don't forget my Tumblers, my coffee tumblers, where I go over blood compatibility. I go over very important cues when you're studying, when you're reading your textbook, words to know that this is important, I need to know this, and priority patients, what type of patients you're going to be running to first. They are on my website now. Make sure you get one, guys. Graduation's coming up. Get it for a nursing student in your life. Get it for yourself. Thank you so much, guys. Everybody who's been supporting me up to now, who's been watching my videos, liking my videos, sharing my videos, leaving me comments, going on my website, purchasing audio lessons, or now getting yourself a coffee tumbler. Thank you for your support. I can't thank you enough, and I ask for your continued support. Please do not forget to like and subscribe below, and you'll be seeing me on the next video.